Are you searching for that voice of reason in these troubled times? Do some things just not make sense? We thought so too, and that's exactly how Dave, Richard, and I came together. My name is Kelsey, and the three of us are here to explore and seek the truth, expose corruption, and unravel and untwist media lies and propaganda. We are determined to help navigate through this unparalleled, extraordinary time in history with everyday people emphasizing open mindedness, free thinking, and a desire to be empowered at the grassroots level, working with what nature has given us and protecting that from those who are exploiting it. Together, with the help of our listeners, we will sow acres of truth. You can visit our website at acresoftruth.com, and here you will find more information on how you can find us in places like YouTube, Rumble, Spotify and Apple Music, Twitter, and so much more. Hello, and welcome to our series outlining, explaining, and discussing the UN Sustainable Development Goals. Our goal is to educate everyday citizens about SDGs, what they are, what they mean, how the laws and policies that are and have been passed can and will affect us. Additionally, by learning and understanding these 17 goals, we can all become one step closer in helping to affect change in this world from a grassroots perspective. My name is Kelsey from Saskatoon, and I'm joined by Dave, Richard, and our special guest, Mark, Director and Founder of the Forum for Canadian Sovereignty. Welcome to SDGs and What You Need to Know. Greetings, gentlemen.
Greetings, Kelsey. It's Dave from Winnipeg, Ag Specialist.
Greetings, Kelsey. My name is Richard, and I'm a farmer from southern Saskatchewan.
Hi, Kelsey, Dave, and Richard. It's Mark here from Saskatoon, Director and Founder of the Forum for Canadian Sovereignty.
Welcome, gentlemen, and I'm Kelsey. I'm a small business owner in Saskatoon, Saskatchewan, Canada. The format of this series is for us to read the SDG, discuss the targets, and break it down for everyday people to understand. So let's get started with Sustainable Development Goal number 3, health. Ensuring healthy lives and promoting well-being at all ages is essential to sustainable development. The COVID-19 pandemic continues to spread human suffering. As of mid-2022, COVID-19 had infected more than 500 million people worldwide. The latest estimates show that global excess deaths, directly and indirectly attributable to COVID-19, could have been as high as 15 million by the end of 2021. The pandemic has severely disrupted essential health services, triggered an increase in the prevalence of anxiety and depression, lowered global life expectancy, derailed progress towards ending HIV, tuberculosis, and malaria, and halted 2 decades of work towards making health coverage universal. As a result, immunization coverage dropped for the first time in 10 years, and deaths from TB and malaria increased. Urgent and concerted action is needed to set the world back on a trajectory towards achieving Goal 3. Mark, we'll get started with you. What are your thoughts here?
So I find it interesting, for decades, us Canadians would brag to the world about our healthcare system and how wonderful it was. Obviously, we have serious issues within our healthcare system, but for us to destroy our nation's health sovereignty by handing it over to an unelected, unaccountable foreign entity that doesn't have our nation's best interest at heart seems extremely counterproductive to a healthy healthcare system. We're talking about the World Health Organization, that is a massive global bureaucracy. And we all understand what happens in a bureaucracy. This is a bureaucracy on steroids. There's no way that they're going to service our needs as a nation and as a people within a nation, our healthcare needs from that perspective. It's actually impossible. So again, in regards to all of this decentralization, radical decentralization of healthcare down to the lowest common denominator, organized by the people in each community, is how we're going to most effectively deal with people's health and how we're going to manage the healthcare system. Again, if we want to keep a system that's within the public purview and not move to more of a private healthcare system. But this is public on a global scale, and nobody has ever been able to convince me that a massive global bureaucracy to do with healthcare is going to service our needs as a people within this country in terms of our healthcare. It's counterproductive. Now, we talk about health. At the end of the day, a lot of these goals that make up the 17 goals of sustainable development are counterproductive to health. They're actually, and as we mentioned in the previous discussions, one of the agenda's primary elements is global depopulation, or population reduction, as they like to refer to it as. And so we're seeing this move, even within our healthcare system in Canada, because we're taking direction and guidance from this global entity. We're now incorporating euthanasia to our elderly, to our depressed, to our mentally ill people, and even just it's been hinted toward our poor, that if life is too hard because you're living in poverty, here's an easy way out. Like we've heard this discussion. So in fact, what I'm seeing from this agenda and from the World Health Organization is this move to not healthcare, but almost sick care, almost death care. It's this move towards, depopulation of the planet. And literally in these people's mind, that is the answer, reducing the Earth's population from, say, 7 billion that we're at now to 1 billion. We've heard them say this. And so when we talk about, and you can incorporate a lot of different things into this discussion, but when we talk about our health, I can tell you that some monstrosity that is a foreign entity, global bureaucracy, is not going to service our needs in terms of health and a healthy society. We have to radically decentralize our healthcare if we're going to serve the people that have paid taxes to ensure that they have healthcare that's going to represent their interests and represent their needs in terms of health.
Yeah, I agree. We need doctors to have the freedom to, practice their medical practices and use the different resources that they need to cure patients. And, not just this open the book and this is what you do. We moved through COVID. We've seen the medical system, a lot of good doctors be, removed or constrained because they ask questions. And, to achieve any goal, you got to ask questions. And that's how you move the ball forward in an honest way, of course. But yeah, what you were talking about, Mark, is absolutely true when you're talking about the MAIDS program in Canada, right? The medical assistance in dying. It is a system that is really quite scary to open up to humanity, because that really means, if you're not sustainable to what? At what bar are we going to let these oligarchs choose if you're not, self-sustainable, or if you're not, if you're not beneficial to the system? I mean, at what point, when you're encouraging people that if life's too hard for you, well, I'd say, you should probably turn to get some psychiatric help or something like that to make you feel better about yourself. But we don't even promote that. It's just go right to this, and that's really Horrible.
Sorry, I just want to jump in and add another element to this. So when we talk about, who's funding the World Health Organization, when Trump was in power, of course, he reduced that funding. Bill Gates became the number one funder of that organization. So now you literally have one person who's the number one funder of that organization now calling the shots and dictating to us our healthcare needs and what's a priority and what isn't. You have one guy who's going to dictate that. That's not a healthcare system that I want any part of, and I don't think most Canadians would want any part of a system that is funded by an individual. And so, of course, things have changed a little bit since Biden government took over. They started funding the World Health Organization again. So the United States is probably the number one funder again. But Bill Gates and his foundation are still up there and still have an inordinate amount of power. And this is where, again, you get into this, global governance and corporate partnerships, essentially fascism. And when you listen to Bill Gates speak, you can hear that he's very much authoritarian and totalitarian, and will remove rights if allowed to do so. If our governments allow that, and it's, at the end of the day, in Canada, say, and obviously this is the discussion we need to have in this country. We should be in charge of our own outcomes. We should be in charge of our own health care and the needs within our health care within this country. This is what sovereignty is all about. But so for a very long time, we've abdicated our sovereignty to an unelected, unaccountable foreign entity that actually does not have any of our best interests at heart as far as the people of Canada. Their scope is global, so all of their decisions are global and has nothing to do with the best interests of the Canadian people. So it flies in the face of everything that Canadians cherish, and so I just find it to be absolutely ridiculous.
Yeah, you're exactly right, Mark. This whole one size, one everything fits all one approach doesn't work for Canadian populations. We have a demographic that's largely aging. We have a lot of baby boomers in there. And let's not forget that healthcare is our biggest expense for tax dollars. And when we look at euthanasia and the made healthcare, if you want to call it that, I call it death care.
Yep.
Veterans seeking medical help or mental help are being offered MAID, not once,
Yes.
not twice, but 3 times during their visit. And this is what our tax dollars are funding. It just goes against everything what this country was built on, and need to go back to a system of healthcare and choice. Do you want certain services? Are you willing to pay for them, whether it's private or public? We do need to have some choice in that. Currently, we don't. We have to leave the country if we want choices for some of our medical treatments. Whether it's Germany, United States, or Mexico, Canadians are going there to receive services, and you can get on a list fairly quickly with the right dollars and cents in your pocket. And the other thing I kind of want to address here is Section 3.5, strengthen prevention and treatment of substance abuse, including narcotic abuse and harmful use of alcohol. Well, this again, it speaks to a good thing is, yes, we all want that. But what we're seeing provincially here is alcohol is already highly regulated. And now if you go into Manitoba Liquor Mart, you will have to scan your ID and you will either be accessed permission to go into the premises or not. And this is just unacceptable.
Wow.
When you are a person of legal drinking age, you should be able to go in an establishment without having to have your identification scanned. Like, where does this come from? We are the testing ground for a lot of this UN agenda stuff. This is not the Canada that our soldiers went to war to fight for and defend. And
Well, yeah, it's horrible.
Yeah, it is. And the other thing is Section 3.8 is vaccines for all. We've had vaccines for access for all for decades already. What is the significance of this and why is it being pushed? And I can only think of this two-tier society that the pandemic exposed, or a plandemic, if you will, where
Mm.
80% of the population who complied with the vaccine requirements were able to dine in restaurants, were able to go to movie theaters. The 20% that elected to kind of go on a wait and see program for an untested drug, they were immediately removed from participating in society, and they
Mm.
were forced to have meals to go. You couldn't order it, well, you had to order everything ahead of time, have it brought to your car, including Walmart Christmas shopping. You have to go to your locker and access the gifts that you'd ordered online. We saw this in 2021. Manitoba was probably one of the most extreme of the provinces, but you could not go and buy a toy off of the shelf because everything had been quarantined and cordoned off. It just is mind boggling. So,
Yeah, I think another thing that we should discuss too is our healthcare system seems to be um, shilling for big pharma. Big pharma has an inordinate amount of power and sway within our healthcare system, and that comes again from the World Health Organization. They're all in this together, um, and it's seeping in to our system here, where now you have doctors that are simply towing the line of big pharma rather than critically thinking and understanding each and every patient as an individual and treating that individual um, for their specific needs and whatever it is, conditions that they have. You have this blanket where it's everything is defaulted to big pharma. We're just going to write a prescription for that rather than treating the root cause of your symptoms. We're just going to do what big pharma tells us to do. They're essentially, doctors have turned into salesmen for big pharma rather than treating the root cause of the problems that their patients are having. And treatment and healthcare has all suffered because of that association to big pharma and essentially shilling for big. So that has to be mentioned in all of this as well.
yeah, absolutely, you're right. Because again, it's no longer the doctors being able to choose an off-label prescription or like anything
Mm.
that's off-label and prescribing that to their client or patient and saying,
Mhm.
here, you know what, this cheap generic drug is going to fix whatever ails you and go with it.
Mm.
But instead, we have big pharma with vested interests saying, oh no, you need to get this person on this and this drug and expense it, whether it's through health benefits or employee benefits through a private healthcare or whatever subscription they have. It begs the question again: is who is telling who what to do? Doctors and nurses are not able to practice the way they did 5
No.
years. Big pharma has stepped over bounds, and it's very concerning to say the least. Particularly when we have all this massive expense, we have huge debt in our country, and we should be able to
Mm.
use a cheap generic label drug to fix our problems. But instead, we have to have brand name under licensed drugs, which have patents on them that are coming in at 100 times the price. It's
And so one of the byproducts to this situation is people's faith in the system, people's faith in the healthcare system, in their doctors, in healthcare staff. It has really waned in the last number of years because of all of this. And I've talked to numerous people that absolutely refuse to go to their general practitioner, their MD, and have gone alternatively to a naturopath or some other alternative medicine, and we're seeing that in droves because people just don't have faith in the system. And that's because it's a system that's being run by the World Health Organization that has no idea what our needs are in terms of healthcare. And I mean, we're not even getting into the whole discussion around First Nations and their healthcare needs and how badly they're treated and how badly they don't fit into this global system. I mean, there's so many things that healthcare covers that. I mean, we could be here for a very long time talking about, the health of Canadians and what we need to do.
Well, exactly. And you will also recognize that some of our Aboriginal populations have unique needs based on their genetic profile. And again, this one size does not fit all. And what about
Exactly
giving our First Nations expired vaccine doses? Like, there's that whole conversation.
Yeah.
How is that allowable that First Nations are getting expired doses when that would go against everybody's wishes? Once it's expired, then it's done. We have major issues here, and we need to call it out for what it is.
Mark, I'd like to ask you something. One of or gentlemen in general here for our listeners, this agenda was signed on to in 2015. Is that correct?
September 27th, 2015, a month before the election of Justin Trudeau, signed on by the Conservative Party, Stephen Harper.
Correct. So the Sustainable Development Goal references and focus on the years since the announcement of the pandemic in March of 2020. Everything that is outlined in the description of this Sustainable Development Goal, it seems as though the goalposts have moved on a lot of the SDGs that we will be covering and have covered already, as these crises seem to, come upon us. What are your thoughts on that?
Yeah, well, so our own Prime Minister in September of 2021 was speaking to the UN, and in that speech, in his words, he said they're using COVID-19 to achieve the goals of sustainable development. And those are the words that came directly out of our Prime Minister's mouth. At that time, it made him one of the most powerful conspiracy theorists in the country, because we'd been warning about, them doing this for decades and referred to and labeled as conspiracy theorists. So, and then his deputy prime minister, finance minister Chrystia Freeland, echoed the same sentiments, saying that, in fact, yes, they're using COVID-19 as a mechanism to achieve the goals of sustainable development. So they're telling us this. Not only that, but you have Klaus Schwab, who, writes his book, COVID-19 and the Great Reset. Somehow they're fully connected. And what's interesting is in June of 2019, you saw them formally develop this partnership between the World Economic Forum and the UN. Again, the World Economic Forum being a support mechanism for the overall agenda. But they've always been associated since the creation of the World Economic Forum in 1971. They've always been there to support this agenda. And so it's kind of interesting to watch how this all plays out. But at the end of the day, they've told us that they've used COVID-19, this pandemic. And I call it a pandemic because there's enough evidence for us to say confidently that this virus, this COVID-19, was manufactured in a lab in Wuhan, and there was a spike protein added to, the cold and flu virus to make it a little bit more transmissible and a little bit more deadly, as statistics will show, affects our elderly people, and so then, of course, from that, they needed to develop this mRNA jab, this experiment that they experimented on billions of people with. So all of it's tied together, and all of the fallout, all of the byproducts of this quote unquote pandemic, where we had lockdowns, we had businesses shut down and destroyed, livelihoods destroyed, jobs destroyed, and created this, this discriminatory society, and all the things that are associated with lockdowns and the trampling of our rights and freedoms and all these things. It's a social engineering and conditioning mechanism. That's exactly what it was used for. And we know this. They created it, and then they released it onto the population around the world through the military games in late 2019. And so, and then they run a desktop exercise called Event 201, preparing all governments around the world for what's coming in this pandemic. And it was all scripted. And then, a couple of months into the pandemic, Klaus Schwab already has his book written and is distributing it to all Western politicians. Here's the script. Make sure you follow it, and we'll be fine. And so this whole thing has been orchestrated. The whole thing has been coordinated, and it's all about, again, this achieving the goals of sustainable development and creating a situation where people who, and they've said it themselves, that in places like Canada, the United States, they would have never been able to convince the masses to give up the rights and freedoms that they gladly gave up in this scenario. And it's all about social engineering and conditioning the masses to accept this for what's yet to come. And they're far from finished. So that's the big picture. That's what we're dealing with.
Yeah, and exactly. I think some of the smaller picture things where you talk about social engineering and creating new norms, we only need to look at what the pandemic kind of exposed here. We had half of the entrance and exits closed at major retailers. So at a superstore or Walmart supercenter, normally you would have two great big entrances and exits. Well, now everything was forced into one. Everybody was to go single line, go queue up on the sidewalk, go through, gates, your checkouts. Now everything had directional arrows on there. And this is all under the statement of we don't want transmission. Well, we all know that viruses can hover in closed spaces. So all we're doing is forcing everybody into a closed space rather than spreading it out, changing the HVAC system and removing the viruses, because that's how we get rid of them, in a farm setting. If we have a dairy barn that we've got a situation we need to control, well, we just turn on the exhaust fans and we move the air through there like nobody's business, and we can put this virus outside of the environment that the dairy cattle are in. Here in grocery stores and supermarkets and whatever not, we did the exact opposite, or they did. And again, conditioning,
Right.
stand in lines. We're being subjected to potential viruses, whether they were or weren't present. We're not going to argue that, but it goes completely against what common sense would tell you to do. But this is, again, conditioning people to line up. Yes, you have to have your barcode scanned. You have to scan your iPhone to go into the restaurant and enjoy your meal, or have your ID scanned at the liquor mart just to come in, while you've got 10 people in the line at minus 40 weather. That's what we had here a month ago. And I see people outside the liquor mart stacked out, and they're waiting to get in. By the time you actually get into the store, you realize there's only 10 people in the store, but you have more people outside in the queue. Like, how ironic is that? And it's just mind-boggling, but it is conditioning people to accept this is the tyranny. You have to wait in line to get a six-pack of beer or a bottle of wine, or even communion wine if that's your thing. So,
or toilet paper.
Toilet paper. Let's not forget that.
Right. So it's interesting how all of a sudden, our distribution, we don't know how to deliver anything anymore. Our airports are an absolute nightmare. We don't know how to run an airport anymore. Right. All of these things, somehow we forgot. Somehow we just lost track of how to run all these things. Out of the blue, it all just happens. It's all by design. It's all orchestrated. Again, it's all about conditioning. And toilet paper, when the thing first started, everyone's hair was on fire about toilet paper.
It's killing free market capitalism once again, right?
Yes.
Is it's making this this one, one brush system, and I realize that in lower developed countries, they don't have, as good a healthcare systems, but they basically, to have the good healthcare systems, I'd say that here, us in the West and Canada, United States, and Canada's questionable in my opinion, but to have that good healthcare system, you have to have somewhat of that free market going on where people develop new technologies and so on and so forth. And there's the money that is not only there that is provided, but also there's the desire to go get it and develop, better things by basically making a one class system. We know how that works out. That means it's like, well, we got the least on the pile and we got the highest on the pile, so we pick the middle. Well, that's not actually going to do any good for moving us forward, right?
Well, and that raises an interesting point. When you look at the overall agenda and who voted for it and who's in favor of it, of course, most of the nations throughout the Western world, their governments just decided on behalf of the people that they're going to commit to this without informing the people. Now, on the other side of the scale, so you have the UN that's made up of 195 countries. 135 of those countries live under a present dictatorship or some despot or some form of communism. And naturally, they don't have a functioning healthcare system. So they're more than happy to sign on to an agenda that they're promised they're going to be delivered, much better services in terms of health. At whose expense? At the rest of the nations throughout Western civilization, at our expense. And again, this goes back to the redistribution of wealth. We're supposed to give up what we're expected and what we've paid into for decades. We're supposed to give that up so other nations can then benefit from our demise. This is why so many countries agreed to sign on to this agenda. And the rest of the Western civilized world, the first world, signed on to it out of virtue signaling, out of, because everybody else is doing it, we better do it too. And so, there it is. This is why we're suffering. This is why our healthcare is swirling the bowl. It's all about redistribution of wealth. It's all about destroying the first world, creating making us equal to the rest of the planet, second and third world. And this is where we're headed. We can see it. It's clear as day. And it's all about destroying Western civilization in the first world and making us all equal, poor, and dependent on some global governance model.
Yeah, that's back to, SDG number 1 about, no poverty. Their goal in there, we didn't read it, but I encourage our guests that we'll be providing links, of course, to all the SDGs. And when you read the bullet points of it, it's like, in that one in particular, it was $1.25 a day. So what does that actually mean? So does that mean $1.25 a day? That means that us Western nations who have that making $20 an hour, we got to subsidize the other countries that are only giving $1.25 a day. What is that?
Right.
So it's, it's bringing everybody to poverty is what it's really doing, and they know it.
Yes, 100%, and that's what they want, because when people are poor and desperate, they're much easier to control.
I just wanted to shake things up here a little bit on one of the targets that is outlined in this health sustainable development goal. And it's 3.7. And for our listeners in reference, if you go to the website un.org, this is where we're getting the information. It's right on their website. And target 3.7 states by 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. That's the target, 3.7. So on the surface, and speaking of the poor countries, one could interpret that, this might be something that would be, a feasible and logical plan for the poorer countries. But as you know, we've certainly been seeing a lot of gender ideology trending in Western in the West here, in the past few years, and we're seeing some very controversial concepts being discussed and introduced to children, which are confusing them about their sexuality, and therefore, in our systems, are seeking, these mutilation programs that are devastating to these children under 18 years old. Is this something that's directly related to to this particular sustainable development goal?
Yeah, 100% it is. And again, this leads into population reduction. So when you put in SOGI, for example, sexual orientation, gender identity, SOGI, SOGI, you put that into the school system, as they have in British Columbia and other places, other jurisdictions, and you start to create confusion within the children that they don't know what they are. Are they trans? Are they gay? Are they all of this confusion at a time when kids really don't need added confusion to their lives. And so if you can create that and this question in the children, then they're going to grow up most likely not participating in traditional family values or the nuclear family or reproducing or procreating, however you want to phrase it. They're most likely going to identify as, trans or bisexual or homosexual or what have you. This is a concerted effort. Now, of course, you're encouraging children to desecrate their bodies and to remove parts because they feel like they might be a girl, because they're being groomed by teachers, because they're being groomed by the system that's confusing these children. And it's all by design, and it leads into this population reduction. They want people to have less children. They don't want people buying into the nuclear family, traditional family values. They want people not to be procreating. This is all part of that. And it's, of course, attached to healthcare, because you have a healthcare system that's actively encouraging kids to remove body parts. And so it all leads again back to this pinnacle of the agenda, which is population reduction and depopulation. So it's all connected, all of it.
And you also have the connection of easy and open access to abortion.
Yes,
this
100%.
is hands down. And I'm going to jump ahead here just for 2 seconds, but target number 5.3, where gender equality talks about female genital mutilation, they want to eliminate that. This is, again, it's a direct contradiction to what the narrative is. So again, word salad, a good play on words. It sounds nice, but once you unpeel some of the layers, there's some really ugly things that reveal their head. And we'll dig into that.
Absolutely.
Perfect. Thank you.
So, Kelsey, there's a video that you might want to incorporate into this that I have posted on my Twitter. It's pinned to my Twitter account, of Dennis Meadows, and he really speaks. Again, he's one of the architects of this agenda, sustainable development agenda. He wrote the book Limits to Growth, which is the foundational piece supporting the development of the agenda. And he does a really good job in 2 minutes of clearly identifying what their goal is in terms of population reduction. He wants to reduce, and believes, and most of the people that are surrounded by him believe, that they need to reduce the Earth's population from 7 billion to 1 billion. And these are all mechanisms in achieving that. And this is one of the overall goals of the agenda in its totality.
Yeah, great, Mark. We'll be sure to do that. And for our listeners, Mark's Twitter handle is Grizz Mark Friesen. So that's GRIZ Mark Friesen. And that's his Twitter handle, and you'll be able to find that there. And we'll certainly incorporate that into these documents and the information for our listeners. That's a wrap, folks. You've been listening to an Acres of Truth special edition podcast series. We would like to thank you so much for joining us in this journey. If you found this episode valuable, please share it with others on your social media platforms. Be sure to check out our website, acresoftruth.com, for more information on other podcasts and where you can find them. Additionally, feel free to send your questions or comments to info@acresoftruth.com. Thanks again for listening.